Ho, ho! Healthcare green has got to go! Hey, hey! Ho, ho! Healthcare green has got to go! Hey, hey! Healthcare green has got to go! Hey, hey! Ho, ho! Healthcare green has got to go! Hey, hey! Ho, ho! Healthcare green has got to go! Hey, hey! We want healthcare! When do we want it? Now! We want healthcare! Do we want it? Now!
Welcome! We have to send a message. We have to send a message. Put single payer on the table. My name's Michael Leidy. I'm on staff at the California Nurses Association National Nurses Organizing Committee. And we are so proud to be a part of the Leadership Conference for Guaranteed Healthcare with the California School Employees Association. The Leadership Conference for Guaranteed Healthcare is the national coalition fighting for HR 676. We are modeled on the Leadership Conference on Civil Rights, which was founded in the late 1950s to fight for civil rights and the justice issue and the equality issue of its day. Today, healthcare is the justice issue of our time. And when A. Philip Randolph, Roy Wilkins, Arnold Aronson started the Leadership Conference for Civil Rights, they were told it couldn't be done. They were told that whites and blacks couldn't live together, couldn't work together. And they kept fighting. We are told today that you can't have single payer, that you can't have healthcare justice, that you cannot guarantee healthcare for everybody. And we will keep fighting until that happens. We are medical professionals, we are registered nurses, we are patients, we are workers, we are school employees, we are teachers. We are every kind of worker in this country who doesn't have the health care they need, and we will fight for it. And together we will amplify our voices, we will amplify our impact until we are heard and until we win.
So that way you're here and we're here.
So I want to start today by introducing Jerry Jenkins. She's a member of our Council of Presidents at CNA NNOC. She is joined on stage by two other of our presidents, Zenny Cortez and Deborah Berger. Jerry Jenkins.
It's great to be here, and as a nurse who still works at the bedside at UC San Diego Medical Center, I've seen up front and personal what this fractured, dysfunctional system we have has done to our patients and the public. I have been at some of these forums before, and it was very interesting because the governor in Iowa cherry-picked who spoke. The one person who spoke about single payer, one of the physicians from Physicians for a National Health Plan, had his comments edited out of what went up on the White House blog. So we know that there is a conscious attempt to stifle our voices. The White House says everything's on the table, but the reality is they're not discussing this, and we want to make sure they understand that 60% of Americans want single payer. Not only that, 60% of physicians support it, nurses support it. We need to get the for-profit insurance industry out of the delivery of care in this country so that we can have a single system with equality and justice and equal health care for all, with a single standard of quality care that everyone in this country is entitled to. We want them to put it on the table, have an honest discussion, an open discussion about it. They're not even willing to cost it through the Congressional Budget Office to see what it costs in relationship to everything else, because it's a slam dunk if you do that. It is the most cost-effective way to deliver a high-quality standard of care to every single American, regardless of whether you lose your job or get sick or have a pre-existing condition. And we think this is the answer. And we're going to make sure the people in there hear our voices today. We want health care, and we want it now.
All right. It is now my pleasure to introduce, we are so proud to be here with the Physicians for National Health Program and their California affiliate, California Physicians Alliance. I cap in the house. One of their leaders, a physician, longtime healthcare advocate, activist, fighter for social justice, Dr. Steve Tarczynski.
Thank you, Mike. It's great to be here with all of you on this important day. The California Physicians Alliance is the state affiliate of the Physicians for a National Health Program, an organization of over 16,000 physicians working to establish a single-payer Medicare for all system in the United States. We know that we represent over 60% of American physicians on this issue. And we also know that survey after survey and poll after poll shows that ever-increasing majorities of Americans support a single-payer solution as well. I don't know how many of you have read this book. Yeah. The Audacity of Hope by our president. On page 177, he writes, "The bigger the pool of insured, the more risk is spread, the more coverage provided, and the lower the cost. Sometimes, though, we can't buy insurance for certain risks on the marketplace, usually because companies find it unprofitable. Sometimes the insurance we get through our job isn't enough, and we can't afford to buy more on our own. Sometimes an unexpected tragedy strikes, and it turns out we didn't have enough insurance. For all these reasons, we ask the government to step in and create an insurance pool for us, a pool that includes all of the American people. Mr. President, only a Medicare for all single-payer system can provide a pool that includes all of the American people." We've heard time and time again from the apologists for the for-profit insurance industry that a government-run system would be un-American, smacks of Western European socialism. It would not be as efficient as the private sector. While CAPA and PNHP believe in evidence-based healthcare reform, not lies and distortions. Actually, in healthcare, government is far more efficient than the private sector. Why else would the insurance companies be so opposed to a single-payer system or to a robust and fully capable public plan option? And as far as being un-American, well, we have our own homegrown single-payer system right here in America. It's called Medicare, and it works very well, thank you. We just want to expand it to cover all of us. We also hear the single-payer system is not politically feasible because it is just too perfect. Well, don't the American people deserve the best? This matter of being unfeasible is a great fairy tale. Once upon a time, independence from Britain was politically unfeasible. Ending slavery was politically unfeasible. The 8-hour day was politically unfeasible. Women's suffrage was politically unfeasible. Medicare was politically unfeasible. You get my point. We don't need the for-profit insurance companies. We just need the doctors, the hospitals, and a publicly financed system that guarantees health care for all and does it by saving $400 billion a year. Everyone would pay their premium on April 15th, and the vast majority of Americans would actually pay substantially less than they pay now, and would get complete coverage that can never be taken away or denied. Doctors will once again happily be able to focus on taking care of their patients without wasting valuable time and money trying to collect fees. Competition will no longer be based on price, but rather on quality and service. That's a win-win for everyone. I want to end by saying that we doctors stand with you today. We will work shoulder to shoulder with you until we achieve our goal of having the White House and President Obama put single payer on the table and include HR 676 in the reform options that will be considered. Yeah.